Welcome to the second hour of Peace of Mind, the show that talks about the physical, emotional, and intellectual pieces of health and wellness that helps you find peace of mind. Here's your host, Scott Grant.
Welcome back to the second hour of Peace of Mind. I'm your host, Dr. Scott Grant. We're here today joining Brenda Harper talking about dentistry, and all dental-related issues are something that we're going to try to address today, and we're welcome and encourage any of you who have any dental-related questions to give us a call. The phone number is 580-5436, and any question, comment, or concern that you have about the dental field, we'd be happy to try to address that today.
Right. So what is the most important thing that folks can do for prevention? Because that's the main thing we're talking about today, is how to prevent dental problems.
Well, there's two ways. Let's talk about maybe first way is what do you do at home, and second way of what do you professional versus layperson services. The best thing that you can do at home is the blocking and tackling of dentistry, which is the brushing and flossing every day, twice a day, morning and night. It's very important in the morning to brush after breakfast. If you're one who gets up in the morning and brushes their teeth and then eats breakfast, well, that breakfast is going to sit in the mouth until those food particles till the evening. So it's very important to brush after the breakfast. And the second most important time is at nighttime before you go to bed, because most of us sleep for somewhere between 6 to 8 hours. And if you leave food in your teeth at nighttime, that's when those, we call them the sugar bugs for the little kids, but that's when the bugs can come out and do their damage at nighttime, when salivary flow is reduced, the food's sitting there, has nowhere to go, and the bacteria eat that, give off a byproduct that's acidic, and essentially dissolve your teeth.
And anytime I eat anything, I always follow it with a rinse of water.
It's a great thing to do. Generally speaking, we're probably a dehydrated people in this country anyway, and it's very important that water can neutralize some of those acids. So that's a great thing to do on two levels. The other thing I'll say, Brenda, is that really it's getting into your dentist and it's having that twice a year examination and cleaning, and letting us find small things that have very simple solutions. If you do those things, if you brush and floss every day and you just do the blocking and tackling, and you get into the dentist, I think you'll find that your dental crises, the issues that you have, tend to be relatively few and far between. Not saying you're not going to have them, but I can just know the patient population out there. Those who do tend to have less problems. Well, let's go to our caller first, Brenda, then we'll get that. We have Kelly and Meridian joining us on the show. Welcome, Kelly.
With, like you were talking about tooth pain today, I have a 6-year-old daughter, and she's getting to the point where she's getting loose tooth and things like that. She seems to complain, that it hurts, understandably, but I was just wondering if there's anything that you can do to help alleviate some of that pain and make it less dramatic as they're, losing tooth and going through this stage of life.
Well, that's a good question. We were talking about what to do about tooth pain and some solutions. Baby teeth are kind of one of those areas that maybe just look a little different than adult teeth. That 5, 6, 7 age group, when kids get to be that age, they tend to start to lose teeth. I generally see there's a couple of weeks of discomfort. There are some products actually over the counter that can help out. For example, many of you know about Oragel. It's a commonly sold product in many stores. It's what it is, a 20% benzocaine. It's just a topical anesthetic that you can actually, for some of these teeth that are sore, that are loose, rub it down around the gums, and it will help kind of those gums. What happens is those teeth start to wiggle out, they become sharp, and they become irritant to the local gums. So a little bit of Oragel is helpful. I find that some people like cold compresses. That tends to help. Obviously soften the diet up a little bit for them. So you got two options. You can go over the counter, or you can go natural, and just know that it is a short-lived problem. The tooth will come out, the permanent won't push through, and the child should have this comfort restored. So.
Okay, so I can just get that at the regular store then?
Yeah, most any store you have, you can go ahead and do that. So.
Okay, perfect.
You bet. Great question. Thanks, Kelly.
Thank you.
Sometimes what happens is when you get this upper tooth pain and the sinus pain, the way you kind of work your way through there is tooth pain generally will start diffuse, meaning that maybe you say, man, my whole upper left side hurts. And then as time goes on, teeth problems tend to hone in to where every day you get a little closer to finding where the problem exactly is. So you may first say, my whole upper left side hurts, and then in 2 or 3 days you point to a single tooth and you say, nope, that is the tooth. So Whereas sinus pain generally will stay pretty diffuse over time.
Stated earlier, until you go in and definitively deal with the problem. So if it's a bad nerve, take the nerve out. If it's a bad tooth, take the tooth out. You know, you just had a filling and the tooth is really still sensitive to cold, which is very, very common. You know, sometimes you have to go back in, take that filling out, put in a material in the tooth to kind of calm the tooth down.
If you have any dental-related question or concern, give us a call here, 580-5436. We do have a caller that's here with us on the line, Sally. Welcome to the show, Sally.
Hi. I have a question about my gum lines. A couple of times when I've been to the dentist, he's told me that I have a little bit of receding gum line, and I occasionally get a little sensitivity. What can I do about this?
Yeah, do you know, has he diagnosed why you have a receding gum line? The other issue is, you know, sometimes the gums get destroyed and they get so far down that they actually need to do a gum graft to actually rebuild that back up. So those are a couple tips from a couple over-the-counter tips, and then there's a certain, you know, also an intervention type dental tip that your dentist is going to have to do for you. But somewhere in between, hopefully you can find a reasonable solution to that.
Thank you. Could I ask one more question?
Yeah, please do.
It seems like our family tends to get canker sores a little more during the tomato growing season. Is there a cause for canker sores, and what can we do for the pain?
Yeah, canker sores are just one of life's pleasures, aren't they? We all get them at different times. The biggest and most important thing, you've hit the nail on the head already, is a canker sore always has a trigger.
We've kind of been going through this. Well, you know, it's just nice for your kids. If they think they have a problem, they probably do, and let's get a look at them.
For some people it's nuts, for some people it's chocolate. There's a lot of different reasons, but first thing you want to do is identify the source. Why are you getting them? And in your case in tomatoes, the thing that I would recommend is that there's an actually over-the-counter supplement that I really like. It's called Lysine, L-Y-S-I-N-E. You can get it at most any store. I've seen them at several different stores. Lysine is a supplement that will help that tissue from breaking down. So during tomato season or any other season when you're prone to getting these canker sores, taking the supplement lysine is helpful. Also neutralizing your mouth with that water like we were talking about earlier to help get that irritant off of the gums is very helpful. And then when you do get one, warm salt water rinses tend to heal and soothe that tissue several times a day.
81. Back to Scott Grant and Peace of Mind on KIDO. It's all here.
Welcome back to our last segment of Peace of Mind. I'm your host, Dr. Scott Grant. We're here today with Brenda Harper. We're talking about dentistry. Just want to remind all of our listeners that this is our last segment. If you have any dental-related question or concern, give us a call, 580-5436. We'd be happy to try to answer your question. Brenda, I do appreciate what you said about my team. They value them. I've actually brought with me today my lead assistant, Kristen. She's brought a tip, something she's learned from our clinic that I want to give her just a minute to go over that.
Hi, Brenda. I miss you. Today, the tip I wanted to just talk briefly about is sealants, dental sealants. I'm a mother. I have 3 kids, and I know that kids aren't the best brushers, and as my kids got their permanent teeth, their permanent molars, it's very difficult for them to brush, and I would try as much as I can to help them, but as they get older they don't really want mom to help as much. And the sealants were something that I used with my children to help keep those teeth from getting decay, because they are permanent teeth and they're young and they don't know that how important those teeth are. And so as a parent, I wanted them to have the sealants on those permanent teeth so that that could prevent having decay on those permanent teeth. And the sealant just, it's a great tool that dentists have, and it's a great option as a parent to help my children prevent those decays that might come along on those permanent teeth that they'll have the rest of their life.
Now, one question that
Yeah, they're great.
You know, Brenda, one question we get, and I'll let Kristen answer this, is most people want to know, does it hurt? Does it hurt to get a dental sealant placed?
It does not hurt. It's just something that goes on the tooth itself. They don't need to have any anesthetic at all. And usually it's very quick. The tooth is dried, the sealant's placed, and it's a rather quick procedure, and oftentimes the kids in our office anyway, they're watching a movie and totally preoccupied with other things and don't even realize what's going on.
Want to know, what does it cost? You know, what does it cost to do that? And you can have all 4 of your 6-year molars and all 8 of your permanent molars sealed for usually less than the cost of 1 filling would cost you. So it's very cost effective to do that and prevent it. That's assuming insurance doesn't participate. Many insurances do, and when they do participate, it's usually no out-of-pocket expense to the parents. So they make a lot of sense financially. They make a lot of sense from a health standpoint, and it's a great blessing to have that we can do for kids.